Welcome to Heartbased Medicine's Heart of Healthcare podcast, featuring Dr. Jacqueline Chan, the science and law of intuition medicine.
Hello, everyone. I am really pleased today to introduce a very special guest to our today's podcast. I'm very pleased to introduce Dr. Jacqueline Chan. Hi, Jacqueline.
Hi, John. Thank you. Thank you so much.
Thank you for joining today. So, Jacqueline, it's a great honor to have you in this conversation. I have already learned a lot, and I thought that so many other colleagues will learn a lot and benefit from hearing from your experience in what you do.
Thank
so
you.
you're actually a board-certified holistic medicine physician, and you will explain to us a little bit more what this actually is and means. And you're, in many ways, this is already explained by that you are a member of the Functional Medicine Institute or Institute of Functional Medicine, and a faculty member of the Intuition Medicine.
Energy Medicine University. Sorry.
Yeah.
Yes, at the Academy of Intuition Medicine.
Yes, and a professor actually, and a professor at the Energy Medicine University.
Correct.
Right.
Yes.
Okay. Sorry if I.
Yeah. Thank you.
So this is really interesting, and this is a very, from the world that I'm coming in, this is a very unusual combination of societies and institutes, and is certainly an area of medicine that I'm not very familiar with. And I believe, though, that it is really relevant to heart-based medicine. And so maybe just to get everybody on the same page, maybe you could explain to us a little bit, how does functional medicine, intuitive medicine, energy medicine complement what we would otherwise describe as, let's say, biomechanistic medicine or mainstream medicine, life sciences?
Oh, thank you so much, John. And I just want to say before I start that I really respect and honor what you're doing and what you're galvanizing and creating here is heart-based medicine. I'm just thrilled with it. So to answer your question, life sciences, biomechanics, we go through medical school and we learn about anatomy as the skeletal, muscular, and organ system, and chemistry in the blood. And then most of our tools are surgery and pharmaceuticals and lifestyle, diet and exercise, of which we learn very little about. And it's mostly disease oriented. So first you have to use the labs to define the disease, and then you find the drug that treats the disease. And this really ignores the branches of medicine that have been in existence for thousands of years before we ever got a drug on, in the medical field. And so those fields like Ayurvedic medicine, which is about 7,000 years old, and Chinese medicine, you were considered a bad doctor if any of your patients were sick. So the idea was to prevent disease. So what I love about functional medicine is it's really looking at how can we optimize physiology by kind of cleaning up the system and supporting the system. And we're going to support the system through natural means. So they're looking at, for example, a particular nutraceutical that can change genomic expression. It's called Nutrigenomics. So we've learned that there are genes, and we used to think the genes dictated the outcome of your health, right? But now we know that genes are adaptable and that they're plastic and that they change their genetic expression based on the environment that they're in. And the environment that the Institute of Functional Medicine and Natural Medicine we look at is predominantly, I would say, kind of nutritional and making sure there aren't toxins involved that interfere with hormones and things of that nature. And so, for example, if we know that N-acetylcysteine is the rate limiting step to making glutathione, and glutathione is the most powerful antioxidant in your liver and in your brain, then taking a very high amount of N-acetylcysteine, more than you would get by eating a food, will push that enzyme reaction and make more glutathione in your body. So what I love about natural medicine and functional medicine is it's really looking at optimizing physiology and trying to help prevent cancer, prevent an autoimmune disease, prevent rheumatoid arthritis, or if someone has an autoimmune disease, kind of cleaning up all those places to help it. And then where energy medicine comes in is acknowledging that there's another whole piece of the anatomy called the biofield, or our subtle energy anatomy. And the biofield is a term that was coined in the 1980s by Beverly Rubik, who was actually a co-principal research investigator with a research study I did from the NIH. And she really saw that our body is made up of electromagnetic fields. And we know that from when we do an EKG if someone has chest pain, or EEG to diagnose seizures. So we know that we have electrical components, but we never think of that really as a form of treatment or how important it is. And if I think we all remember mitochondria and the Krebs cycle and the electron transport chain and oxygen delivering electrons and making ATP. And we need ATP to generate every single enzyme reaction in our body. Well, that actually is based on electricity, electrons. And so later on, we discovered that, for example, Fritz Pop was a physicist who discovered that the DNA in cancer cells becomes incoherent and non-harmonic and scrambles light and starts showing confusion, in a way that we're realizing that there is an important aspect to the natural voltage in our cells. And I'm sure cardiologists understand a lot about calcium ion gated voltage channels and things like that. We understand that language. But one thing that we have not been taught is that you can actually manipulate your own electromagnetic field through your own meditation and intent. And there's a specific process for that. And you can create more coherence in your body. And when you create more coherence in your body, the first thing that happens is a balancing of the central nervous system. So it's calming down the sympathetic fight or flight, and it's increasing the parasympathetic. And we already know with that, there's a whole slew of health benefits, because we know that with elevated stress hormones, you have increased inflammation, you have, depletion of the neurotransmitters in the brain, insomnia, and then insomnia results in all these other health depletions. So, and we know that balancing that can be excellent. I remember when I was in Germany, I went to the baths in Baden-Baden, and where they bathe you and they scrub you and you go in a sauna. It's like, God, these Germans haven't figured out. So, so we know that spas and things of that nature, and just going to the beach and relaxing, that's the way kind of the world gave us that gift. We all know how powerful it is to recoup or have a good night's sleep. Doesn't take a neurosurgeon to understand that. You don't have to be a quantum physicist to understand that. But what's really happening when we get in that relaxed state is we actually are developing a coherent field. That coherent field at its most subtle level, if we were going to take a microscope and really look at, well, what is she talking about? And what is that? That's the recognition that aside from our physical body, our muscles, our bones, our nerves, our organs, and our blood, and everything in our blood, our veins, and interstitial fluid, and matrix, intracellular matrix, all of that. Outside of that, there is something that's communicating. There's an information exchange, right? So what's generating that information exchange? And that information exchange is super important. I mean, we all know blood circulation is super important and venous circulation. So that information exchange is being guided by an intelligence. And that intelligence increases the more coherent you are, and that you can develop and enhance your own coherence. And then with training, if you have the propensity to be I don't like to use the word healer, but some people are able to see the energy anatomy psychically, which is one of my strange superpowers or skills, then you can actually shift that. And you're shifting it with an energy that is a combination of your own enhanced divine energy with your compassion and with your intention, with very clear boundaries, energetic boundaries. And that is super powerful. And that is what has allowed people to, for example, in Chinese medical Qigong, which is like the Asian version, they can remove their final exam is to take their hand and put it over wine and remove the alcohol from the wine and put it in water, a glass of water. That's their final exam. Now it's 6 years of training, about 6 hours a day of Qigong to do that. And I don't have that kind of time, but we don't want to forget that one of the most powerful tools that has ever existed before we came up with drugs and before we came up with surgery and before we came up with electrical devices that you can plug in and give a frequency, one of the most powerful drugs is actually the own photonic energy that can come from our own body. And that you could think of as laying on of hands.
Just explain two things to me a little bit so I can catch up with you. You were talking about the subtle energy anatomy. What do you mean by that? You were kind of contrasting this with, let's say, the anatomy that we learned in medical school. And you're saying there's something in addition to that, which is a subtle energy anatomy. Is this something similar to the anatomy that I learned in medical school, or is it all different?
I would call it the chakras and the auric field. So yoga, people who study yoga really understand this, but there are actually, Valerie Hunt was a scientist who mapped out distinct changes at the area of the surface of the skin that correlated with 7 major areas in the body, which correlate with your chakras. And these are chakras are like transformers. So basically they help transform high frequency vibration and connect it to lower frequency vibration, which is in the dense tissue. And there is a link also with meridians and meridian channels, which have been proven to actually exist in acupuncture. So these are like energy lines. You know, we don't see them, but they are measurable with devices, and they are distinctly different. And what they're both doing, acupuncture meridians and chakras, what they're both doing is they are increasing the coherence. It's like they're integrating the information exchange in our body at all different levels: physical, emotional, and mental, and spiritual.
Okay. It's like an energetic connective tissue, if you like. And
yes, perfect. That's exactly what it is. That's exactly what it is. So probably all of us can relate to, let's say you get in a car and it's a Sunday and you're going on a beautiful drive to the woods where you're going to go hiking, and you're kind of daydreaming, right? So you're sort of, when you're out of that analytical mind, you're daydreaming, and then maybe you have an insight or an inspiration or something that pops in. Or maybe that happens to you when you're listening to a symphony. And your symphony, we all understand how certain chord structures or musical chords can sound beautiful. We consider them beautiful. Well, they're actually generating a coherent field, you know, versus like a discordant, you know. That's why musicians spend so much time tuning their piano to perfection, or their violin to perfection, or their guitar needs to be tuned. And so you can tune your body in that same way. And then let's say you're sitting in the symphony and then you get an insight, or you get a creative inspiration. And so what's happening is, you could think of it as your right brain, your intuitive side, your right brain is online, and that set of information is profoundly valuable. I mean, profoundly valuable.
Okay. So what I hear from you is that you're describing is like, one, the anatomy and physiology that we learned in medical school is kind of derived from our five senses, also described by the same anatomy and physiology, right?
Right.
So that's that realm, and then there's another layer, or another possibility to receive, to perceive.
Right.
Elements that are part of what makes up a human being, that are not perceived through the five senses, but they can be perceived. And you're describing this as an energetic awareness. And that energetic awareness is able to be tuned and to be refined, so that we can actually appreciate the harmony in the human body, and see whether this harmony is still intact or not intact. And then we can, with intention, work with this. Did I?
Perfect. Yes.
Okay, I'm learning. Okay, thank you. So that's very good. You made that very clear. So let me just, you mentioned, this is really fascinating. You mentioned the biofield, and you were then kind of zooming in on the electromagnetic field. And I'm wondering, is this the biofield, the electromagnetic field, or is there maybe more to it? I'm thinking.
There's more to it.
Go ahead.
Yeah. So the biofield has three major subsections. One is the electromagnetic field. One is quantum fields. And the other is photonic light. Okay. And potential fields. I am not a quantum physicist. So the best way I can describe it is that the laws, the physical laws that the physical body undergoes, are different and opposite to the laws that the quantum fields undergo. So for example, probably we all remember what entropy is. Entropy is, without addition of energy, everything will go to chaos. Over time, there's decay, right? And then there's chaos. What the etheric or quantum fields, the rules that they go by is that instead of opposites attracting and things of the same nature repelling, things of the same nature attract, and things become more harmony, and they don't, over time, they don't go into entropy. So it's actually a complete opposite set of physics laws that this part of our subtle energy anatomy undergoes.
That's really interesting. So let me come from a little, maybe a slightly different angle, and obviously we're both not quantum physicists here. So to understand the kind of 101 of this, if I remember from the history of how this came about, so from kind of Einstein's idea, hypothesis, theorem, and then the group of physicists around Planck, Bohr, Schrödinger, Heisenberg, trying to actually prove this theory,
particle.
What I think Heisenberg, I think, came out with a complementarity. So was it, or no, it was Bohr actually, I think, came out with a complementarity of wave and particle.
Yes.
So we have a way to look at the world, to appreciate the world as particles, as a composite of particles. And the way we learn classic anatomy and physiology is breaking down the body into its organ systems, into its organs, and smaller, smaller, smaller until we arrive at the particular level. And so it's a very kind of deductive Cartesian world model. At the same time, there seems to be a different perspective of the same. I think that's what Bohr was struggling with when they heard about what happens when we split, when the nucleus is split. So this is, where's this energy coming from? So when they discussed this, then they were kind of both describing the same phenomenon from different perspectives. What was reality, not truth, but what was reality could be described from two different perspectives. Is the way that you described energy medicine, let me call it now wave medicine, as being complementary to particle medicine, biomechanistic medicine. Could this be that these are two different approaches looking at the same reality, if you like, or looking at the same thing, but creating different realities, different perceptions of the same thing? Is that a possibility?
Well, I think the way I'd like to answer your question is that when quantum physics includes the power of the observer, so in the Schrödinger cat experiment, they observed that when you look at a wave and you put an observational intention, that wave becomes a particle. You actually almost like affect the wave and it comes into solid reality. And, we've seen those posters like, if you believe it, you can achieve it. And we've heard those phrases from Buddha: your thoughts create your values create your actions become your life, right? So we all can understand that your intention can become, and your values become, what your life ends up looking like. And Professor William Tiller, who was right nearby me in Stanford, actually proved that our intention and our thoughts can change electron size, number, which is unbelievable. He's saying that our thoughts and our intentions actually change the number of electrons. And then this kind of ties in with placebo effect. We've all heard about the power of placebo effect and nocebo effect, where the doctor goes in and says, you have 3 months to live with this cancer, and then that person dies. And then like, oh, sorry, it was the wrong diagnosis. Like the power of our belief system is profound. And that's because if no one had conceived of being able to get on the moon in a rocket, it never would have happened. So we all know that the power of the mind is profound. And so quantum physics really includes that power, whereas science is, the Cartesian model is, let's split our mind from it, and we have to measure everything. And that served its role and was valuable, and we needed to do that. But we're at a place, because we understand quantum physics and we have quantum physicists, because we're able to understand this wave particle thing. That's our new model of science. And we need to kind of step into that.
Certainly a long way to go, it seems like. But this is...
Well, the indigenous people have been doing it for ages, the ancient people.
Yeah.
They would go into a meditative state. Maybe they would take ayahuasca, and they would understand that this tree leaf is going to treat diabetes. They would know. They would actually communicate with the herb and get the whole use of the herb. They're not doing it through a microscope and through their logical mind. They are gaining information in a different way.
Yeah, and this is what I guess Homo sapiens has been doing, at least for the time of existence before the last 200 years, where we were kind of really going into this sort of exercise. Yeah, so that's really interesting. So let me just see, can we find an example, or could you find an example where we're saying, following this thought of thoughts create reality. Thought forms create reality. Or you were kind of touching on Planck, I think, saying matter as such doesn't exist, but matter exists, obviously, but not as such. So there's an intention behind this that does seem to create this. So if that is so, and you're looking at your patients, could you give us an example of where, let's say, something that has a biomedical name, a diagnosis, could actually be seen through a different lens, and then leads to a different approach and possibly a different level of the healing process? Talking about energy blockages, maybe a thought form creates an energy block that creates signs and symptoms. Signs and symptoms have a medical name. You get the question? Yeah, great.
Absolutely.
Could you give us an example of so we really see this alive?
Yes, I have two good examples. So one is a patient came in with shoulder pain, acromioclavicular. He'd had it for 3 months. He could not extend his arm and put on a shirt on. And he'd been to an orthopedic surgeon who injected a steroid, and it didn't do anything. Or maybe it helped, he said, like 5 or 10%. And so I'm trained in osteopathic medicine. So I did my shoulder movements and clavicle release and all of this. And he still had a lot of pain. And I said, well, look, I just graduated from the Academy of Intuitive Medicine. Do you feel comfortable if I just totally switch gears and I'm going to create an energetic, sacred space around you? And I'm going to use my hands, and I'm not going to touch you. I'm going to just float my hands above you and look through my palms at what's going on. And what I saw was that there was a lot of energy that had built up in the shoulder areas on both sides, but predominantly on the left side, that was not from him. It was actually all the energy from clients he'd been working on, because he quit being an accountant and he started becoming a massage therapist. And he was a very empathic, kind of sweet, gentle person. And I said to him, you've got to release this energy buildup. And I basically helped him see what the issue was. And then once he had the understanding of what the issue was, he was able to completely, with my guidance, sort of release all of that energy, and all his pain went away and it never came back. So he actually left the office with all the pain. The second example is a woman who was a therapist who came to me with neck pain, and she'd been to a chiropractor, she'd been to acupuncture, it had been at least 2 months of treatment. And I laid her on the table, I created a sacred space, and what I saw was a black, like, cord in her neck, and there was a man associated with it. And I said, is there something, the neck is about communication. I said, is there something that you are having a difficulty with a particular man in your life? And she said, yes, it's my husband. And so I said, well, let's take a look at that. And I saw that there is something that she needed to understand at an emotional level about her husband, which was this: she came to the understanding that her solution was to have couples therapy, and what his solution was to have more fun together. Not more therapy, but more fun. And so when we came to that clarity, all the pain went away. And actually the next time I saw her, relationship with her husband was dramatically different. She said, I followed what you told me to do, which was to start having fun and not do more therapy. And, so we probably have all encountered a patient where the pain is actually a message. It's like a life message. Rachel Naomi Riemann wrote a book called Kitchen Table Wisdom, which was all these stories of patients and how their situation was a life message for them that they needed to. And so the beauty of it is sometimes the illness isn't there to be fixed really quick. Sometimes it's there because it's the only way that person's going to stop and change something in their life. Yeah. And then that's when the blessing comes in. And I think physicians really knew how to do that and include that in your differential diagnosis, if you will. life circumstance, relationships. And energy medicine allows you to see the auric field and the chakras in such a way that those other things can be addressed.
Beautiful.
Factors. Mm-hmm.
Wow, Jacqueline, this is really fascinating. I'm really fascinated. And, you know, it would be so easy to just disregard all of this, right? It would be so easy from a biomechanical trained mind just to say like, this is all bogus. This is just like, yeah, you play shamans kind of thing, right? So basically dismiss everything just because it doesn't fit the frame. And I see this done a lot. And there is certainly a temptation to do so because it makes things so easy. If you just, you know, it makes your world much simpler, right? And a lot of the Cartesian world model is the very laudable aim to make things simpler so we can try and understand questions. Now, if we want to be a real scientist, and this is a bit of a call to my colleagues who are kind of brushing all of this away, if we want to be a true scientist, we would like to accept this as a hypothesis to be tested. And we have two very, very strong reasons to have this hypothesis of energy medicine to remain here as a hypothesis to be tested and to be further explored and better understood. One is that the kind of particular medicine that we talked about is only, 200 years old or something, that we're really going into this seriously. So it's a very young science, if we like. And the intuitive medicine, so where healing powers of plants or behavioral healing was perceived and received and intuited, seen, that is much older. That is as old as the human species. So, and now actually there are structured attempts. So you described, okay, there's Ayurveda, there's the traditional Chinese medicine with Qigong, and now there's within the Western world, there's now an institute of intuitive medicine, an academy of intuitive medicine, and there is an energy medicine university. Okay, so there's now really academic kind of rigorous science approaches to see, can we, in spite of the different perspectives, waves and particles, can we actually integrate those two? So a little bit like as this effort is going on within the realm of physics, this is a very similar or parallel integrated effort is going on within the realm of medicine. And this is really, really interesting. That's very new medicine from our young medicine's perspective. So thank you. Thanks a lot for outlining these, the understanding behind energy medicine and how it complements particular medicine. And thanks for sharing your experience. We really hope to learn more from you in the time to come. And we already talked about working together and developing courses together so that this experience and this energetic awareness that you were talking about is something that can be actually learned and can be experienced by those who are interested.
And Jan, I would just like to add that this ability is natural and each one of us have it. We really do. It's just been unsupported in our lives and become like a vestigial perception, but we all have a sixth sense. We all do. And probably almost everyone you talk to could name at least one intuitive or synchronistic event that they've had in their life, and how magical and joyous it may have seemed, like, oh my gosh. And it's all over in the movies and the novels. But there's a slew of scientists that I could name. And I think we're at time, but there is a lot of science to support this.
Thank you. Thanks a lot. So if people wanted to, I guess that several people in the community will have questions and would love to follow up with you or maybe ask you additional questions. How could people be in contact with you if they had additional questions for you?
Yeah, the best place really is to email me through my website, which is www.drjacqueline.com. and that's spelled DrJacqueline.com. And there's no period after the DR. It's just Dr. Jacqueline.
Thank you.
Yes,
Thanks a lot. That's really wonderful. We also put the link under this episode. Thanks a lot.
Thank you so much, Dan.
For joining us.
Okay. Take care. Bye-bye.
This has been a Heart-Based Medicine production. Thanks for listening.